Professor, Senior Assistant Professor, School of Pharmacy, BBT University, and our today's topic is prescription and cost. So let's start. So first of all, I will explain what's the definition of a prescription. So I think everybody knows what is prescription and listen somewhere that prescription is given by the doctor. But what is the proper definition so you can understand, you can read that is the word prescription is derived from the Latin term prescriptus, which made up of two Latin words, phrase of prescript meaning before and scribe to write. Prescription is an order written by a physician, dentist, or any other medical practitioner to the pharmacy to compound and dispense a specific medication for individual patient. So, prescription, you can understand that it is given by a registered medical practitioner that should have a proper registration or medical certification number given on a registered prescription blank, which is a legal document, and in that legal document, information of the prescriber should be mentioned on, and only that blank is allowed for the prescription right. Uh, so, prescription is an order issued by a physician, dentist, or any other medical practitioner to the pharmacy to compound and dispense a specific medication for individual patient. To compound means to mix, to saturate, or to dissolve something or a full ingredient to make a final dosage. So, a proper, a clear written prescription is playing a very important role because a clear instruction give a dosage form with a clear instruction, and the compounding of that dosage form is easier. So a clear and a written prescription is very, very important role. So after compounding, a pharmacist dispense a dosage form according to the physical form, like it is semi-solid or solid, or it is present in the liquid form. So according to the physical parameter of any dosage form, uh, pharmacists label and dispense the specific medication to the patient. Second one is prescription is accompanied by direction for the pharmacist and for. So direction is very important because some of the direction is clear or specific by the doctor. So it is the responsibility of prescriber or doctor to write the instruction for compounding for dispensing of any dosage form so that pharmacist can follow all that instruction and can compound a specific dosage form in a right way so that he can give the proper information to the patient. So coming to the types of prescription. So the first one is pre-compounded prescription. Prescription for already prepared drugs. Like now these days you can see that most of the drugs are pre-prepared. When we show prescription by a prescriber to any pharmacist, in most of the cases we take tablets, capsules, syrup, or injection that is pre-compounded. That means a pharmacist not need not to prepare at the time of prescribing. So that type of prescription is known as pre-compounding prescription, and that, for example, ciprofloxacin, paracetamol, there are ampicillin. So there are many formulations which are available in the market. Now, extemporaneous prescription. The pharmacist prepare the medication according to the drug and dosage directed by the physician. So coming to this point, like as I said in the previous slide, that instruction should be very clear regarding the compounding and dispensing by the prescriber. So in this type of prescription, a clear compounding and dispensing instruction is very important. It is given by the prescriber, that is a doctor. So pharmacists prepare the medication according to the drug and dosage directed by the physician. Nowadays, not in practice nowadays, in most of the cases, we take pre-compounding prescription, that is pre-prepared prescription or drug by the companies. So now these days this is not very common. Coming to the next slide. Now, parts of prescription. So parts of prescription is divided into many parts, and we have to understand each and every part in a very clear way. So the first one is date, then name, age, sex, and address of the patient. Third, superscription, inscription, subscription, signature or signature, renewal instruction, then address, registration number of the prescriber. So a written prescription consists of mainly 8 parts, and each and every part has a specific information which we will discuss in next slide. So we can divide parts of a prescription into 3 parts: heading, body, and closed. Heading consists of the personal data of a patient. Body consists of superinscription, prescription, subscription, while closing consists of signature of patient and signature of physician. So coming to the date it helps a pharmacist find out the date of prescribing and date of prescription for filling the prescription. So date is very important because at the time of renewal of the medication or at the time of listing of prescription, date is important so that prescriber or doctor can also understand that for how long the past medication was given and what is the condition of the patient. So date is very important. Second is the name, age, gender, and address of the patient. So a clear name should be written. Age is very important. Gender is very important because um, as age varies, the dose also varies. Because we cannot give a same dose to a newly born baby, or we cannot give the same dose to an adult or old person, because the process of physiology varies from age to age. So age is playing a very important role while considering the dose of any medication. So age and gender. Gender is also playing a very important role because in case of male and female, body weight varies, rate of metabolism varies. So gender is also very important. That should be mentioned on the prescription. So that must be written in the prescription because it serves to identify the prescription. In case if any of this information is missing in the prescription, the same may be included by the pharmacist after proper inquiry from the patient. In case all these information is not written or missing, so this is the responsibility of pharmacist to collect all the information and be right on the prescription, and also used in dose calculation for the children. So this is all about the date and mean age. That is the second part of prescription. Now coming to the next slide, that is superscription. So it is mainly represented by RX symbol. I think everybody understand or everybody knows at least this sign. So RX means it is mainly word or mean or usage. That is the short form of Latin word. So superscription mainly consists of a symbol that is RX. That is word of recipe or usage. Now, fourth part is the inscription. So, superinscription, inscription, subscription is mainly the body of a prescription. So, inscription mainly consists of, this is the main part of the prescription, or the contains the name and quantities of the prescribed ingredient. As I said in the last slide, that compounding instruction should be written very clearly. So, compounding instruction consists of the name of the ingredient and the quantity of the ingredient. So that is the compounding part mainly covered by the inscription part, in which the quantity and the name of ingredient is written very clearly. And according to the name, according to the quantity, and according to the instruction, this is the responsibility of pharmacist to compound medication according to the instruction given by the prescriber. Or if there is any confusion regarding the spelling of the ingredient, or the it is not written very clearly. So this is the responsibility of pharmacist to consult with the senior pharmacist, and that senior pharmacist will consult with the the given amount of ingredient to be compounded so that dosage form can be prepared. So the name of each ingredient is written on a separate line along with its quantity. The next part is the subscription. This comprises direction to the pharmacist for preparing the prescription and number of doses to be dispensed. So, what is the direction? You have to saturate, you have to mix, you have to dissolve, or heating, or preparation. So, there is a lot of steps involved in the final dosage form. So, what kind of direction is given to the pharmacist for preparing that prescription or for preparing that medication, and number of doses means how much doses you have to divide. If you are compounding or if you are dealing with a prescription which are pre-compounded. So if the prescription consists of medication which are pre-compounded, so prescribers retain the doses. But if you are compounding the medication, so you have to give information to the patient that how much doses you are dividing and how much doses you are giving to the patient for how much day. Understand? And the next one is the signature or signal. This consists of direction to be given to the patient regarding the administration of the drug. So, how to administer? You have to administer the drug before breakfast or at bedtime, or you don't have to take one medication with another. So, all this information is given by the pharmacist to the patient so that we can understand what is the importance of instruction and that patient can attain a significant amount of therapeutic information by the pharmacist. So I have shown an example of prescription. You can understand that the upper part consists of the date, name, registration number of the prescriber. Then patient information consists of the name, age, address, and the date. That is, I explained what is the importance of this in general and the weight. Then RX. RX means superscription. Then it consists of inscription, which consists of the amount, the name of the drug, and the quantity given in the right. So subscription mainly instruction to the pharmacist and then instruction to the patient. So this is a sample by which you can understand the different parts according to the parts of prescription as I discussed on the last. So after I think after understanding the different parts, you can very well understand that what is the importance of prescription and how it has been divided into different parts of the prescription. Thank you.